The numbers are certainly concerning, especially with the rate of COVID-19 vaccinations slowing down. Cases up in our area, numbers up in the hospital, our positivity rate now up over 11%, nearly doubling from the week before. So to give us an idea of what we need to know at this point in this pandemic, Dr. Ruth Berggren joining us as she always does on Thursdays, infectious disease specialist with UT Health San Antonio. Good to see you as always. Tell us what we're dealing with right now in San Antonio in terms of these numbers. What does that say to you?
Yes, well, this was not unpredicted, right? I mean, we knew that with the Delta variant and with large numbers of people remaining unvaccinated, that we would see increased numbers of cases. We've seen a doubling, and we knew that we would see more people in the hospital. And so we have roughly 250 people in the hospital in San Antonio right now. That's up from 117 last month at the low. And, you know, this isn't nearly where we used to be 6 months ago, and we had over 1,400 hospitalized, but we don't like this uptick. And we know exactly what we need to do about it, though. Exactly what we need to do is get everybody vaccinated.
Are these young adults that you're seeing? I mean, what are the ages that we're seeing of the people that are coming in and the people that are hospitalized?
Yeah, you know, 95% of the hospitalized people are unvaccinated. That means it's rare to have a person with COVID in the hospital that was vaccinated. And a lot of them are in the more youthful age group. And right now, only a third of our 15 to 29-year-olds in San Antonio are fully vaccinated. So we'd love to focus on this group and motivate them to come on in and get vaccinated to avoid landing in the hospital, because it isn't only older people who get hospitalized. You know, quite frankly, most of our older people in San Antonio have been vaccinated, and yet we're seeing the hospitals start to fill up again. So it's an issue for sure for young adults and young people.
We know that the vaccine is widely available. There are several places that you can go get it without having an appointment. So for those who still have not been vaccinated, what's the scenario you believe that those people are facing, or the potential for them to get infected with this Delta variant now?
Yeah, I mean, I think folks are paying attention to stuff that they're seeing on social media, which is oftentimes very misleading. And we're in a phase now where lots of people are taking off their masks because, as the CDC guidance said, you don't have to wear a mask if you've been vaccinated. So everybody's taking off their masks, both the vaccinated and the unvaccinated, and that leaves the unvaccinated people unprotected. And so what they're facing is the potential to get sick, with this Delta variant, which is becoming the dominant variant across the United States, and which we have seen is more infectious to other people and can be more lethal and make people sicker quicker than the original variety of the virus that we had.
Yeah, and we're seeing this across the country. I mean, Los Angeles County today just reinstituting its mask mandate there. My next question is kind of twofold. What does this mean for back to school? And is there a real problem with people just getting the first dose and not coming back for the second dose when we're talking about Pfizer and Moderna?
Yeah, let me take the second question first. In San Antonio, we have more than 200,000 people that didn't come back for their second vaccine. So I'm talking to you right now. If you're in San Antonio and you're one of those 200,000 that didn't come back for your second vaccine, you need to know that you're not very protected at all against this new Delta variant, only about 33% protection if you've had one dose. So come on back and get your second dose. It doesn't matter how long it's been since your first dose. Just come on back and try to get the same variety of vaccine that you got the first time. In other words, if you had Moderna, get Moderna. If you had Pfizer, get Pfizer. But one way or another, come back and get your second dose. Now, what about back to school? Well, we're in the middle of July right now. And as you know, it's 21 days in between the first and the second dose of the Pfizer vaccine. So if you started now, you could get yourself fully vaccinated by the time you go back to school. And we strongly urge people to do that so that they can go to school and pay attention and not be constantly nervous or worried about whether they're going to get sick or whether they're going to take the virus home to somebody who's elderly or unprotected at home. So back to school will be best if we can get as many people 12 and up vaccinated as we possibly can.
And back to school is going to be here before we all know it. It seems like with cases increasing, numbers in the hospital increasing, a big question a lot of people ask first is, were people vaccinated who have been infected? And we did get a viewer question kind of speaking to that point that a lot of people wonder. This person asks, with COVID cases increasing, it's been said that some infected people have been vaccinated. Do we have any idea which vaccines these people received who have been infected despite being vaccinated?
Yeah, I mean, so this is very well documented. Nobody would deny that we've seen cases of COVID with symptoms in people that are fully vaccinated. It's rare, though, and the vast majority of those fully vaccinated people do not get sick enough to go to the hospital, okay? Now, what we know in our own hospital is that the vast majority of the sick people, the COVID people with symptoms bad enough to get them hospitalized, they are unvaccinated. There are a few percent, maybe 5%, are people who were vaccinated and wind up in the hospital. But as far as whether it's the Moderna that's failing versus the Pfizer versus the Johnson & Johnson, we don't have that kind of granular data from San Antonio, but we can go back to the population data that's been released by the companies that make these vaccines, and we know that the mRNA vaccines, Pfizer and Moderna, tend to be 94 to 95% effective at preventing symptoms, whereas the Johnson & Johnson vaccine tends to be more like about 64% effective in preventing symptoms.
Dr. Ruth Berggren with the Long School of Medicine at UT Health San Antonio. As always, we appreciate your help in separating the fact from the fiction that's out there. Thank you for your time.
Don't miss your shot. Don't miss your shot.
Or your second one.
Yeah, either one.
We'll see you next week.